Hi. It's not unlikely that each of us knows at least somebody, or even is somebody, who currently has to deal with a difficult mental illness like bipolar disorder, major depression, or schizophrenia. Yearly mental health costs in Australia amount to around 4% of GDP, or over $60 billion. Now, these mental illnesses can improve or deteriorate, sometimes quite quickly, and the consequences can be pretty severe. We're talking loss to quality of life, time at work, close relationships, and in the extreme cases, even human life. The current procedure that psychiatric clinician will use to monitor the current outlook of a patient involves these infrequent meetings with the clinicians and the patients, usually probably about once per month. The data that the clinicians collect from the patients in these meetings is usually just self-reported, and it's cross-sectional, so it's just at that one point in time. So this data is not sufficient for making accurate predictions over days or even weeks ahead. Now, what my research aims to do is to monitor and forecast the outlook for psychiatric patients using data inferred from smartphone sensors via an app that the patients will volunteer to have installed on their phones. The most desirable outcome of this is that the clinicians will know when it's a good time to intervene with the patients days ahead of a tragedy. I'm collaborating with some researchers in the field of neuroinformatics and psychiatry from the University of Montreal, who've developed a mobile app that will be used to monitor 100 psychiatric patients over a period of 100 days. The patients will update us daily on how they're doing via daily self-report surveys. Meanwhile, we collect a continuous stream of sensor data from their phones, like GPS, for example, but we don't collect the GPS location. Instead, we just collect certain inferences from the GPS data. So, for example, we're collecting the amount of entropy in their movements. Other sensors that we'll collect inferences from include the accelerometer, the barometer, microphone, keyboard, and so on. Of course, with all of these data, we're collecting inferences rather than the raw data to respect privacy. The collection of these data is referred to as the digital phenotype of the patient. So we're trying to build a predictive model to forecast features of each patient's self-reported survey results as a function of the patient's digital phenotype. In phase 2, the app will be made public so that the sample size can grow a lot bigger. To the best of our knowledge, in the literature, there has not been any demonstration of using intensively longitudinal data for achieving continuous and automatic prediction of psychiatric symptoms. Furthermore, there aren't any coherent frameworks for modeling the digital phenotyping data arising in smartphone neuroinformatics. So my research aims to fill these deficits, and I hope that it can be used to do some good for people. Thanks a lot.